So it's estimated that about 10% of the United States population, so that's 1 in 10 people, have an autoimmune condition. So why is this? So my last video, I talked about environmental toxins, how around the turn of the 1900s, that's when processed foods really came into play. That's when farmers started using herbicides, pesticides, and these chemicals that were made for various reasons are ingested into our body through our gastrointestinal tract, or we breathe them in, our mucous membranes, they get put on our skin. And because our bodies don't recognize these things, it creates these antibodies, which is part of that adaptive immune system. So basically my approach here is I want to look at every single part of your health history. We want to leave no stone unturned. So make an appointment. I'll send you the intake paperwork, which screens for autoimmune conditions. It asks about your family history. It asks about the symptoms you have been having. When did these start? What medications you're taking? What diagnosis you have had? I get loads of information before you come in, and then we sit down and talk about things. So the Institute for Functional Medicine, which is where I did my training for functional medicine, taught with autoimmune conditions, 3 things must be present. And those 3 things are a genetic predisposition. So most people with autoimmune conditions, they have a family history of autoimmune conditions. Some type of trigger, which can be a bacteria, a virus, COVID, fungi, protozoa, and a lot of these environmental toxins. And then the third thing, which is often overlooked in mainstream medicine, is intestinal permeability or leaky gut. So one of the first tests I do on my patients that come to see me here is the KBMO FIT test. So KBMO is a lab out in Boston, and the FIT stands for Food Inflammation Test. So basically the test looks at 132 foods, chemicals, and additives and sees if your immune system is mounting a response to these. The second part of the test, which is super important, is just looking at that gut barrier lining. So it's testing for candida overgrowth, which is super common with our highly processed foods. Candida tends to feed on sugar. It also looks at that leaky gut markers, which are zonulin and occludin. And then it also is looking at lipopolysaccharide activation, which is part of a bacteria that can seep in through that leaky gut. So if you have leaky gut and this test shows you do, and you have a previous diagnosis of an autoimmune condition, we hone in on the gut. So 70% of your immune system is modulated by that gut. So we cannot disregard the gut. And then we look at the modifiable lifestyle factors. You know, we've got to look at your sleep, your stress, your diet, your exercise, your relationships. So while it's super complex, I want to take a systematic approach with you and get you feeling better.